Already, people who have plans that predate the Affordable Care Act can keep those plans if they haven't changed. That was already in the law.
As disapproval for Obamacare continues to grow, the president spoke Thursday announcing those with canceled insurance policies will now be able to renew them.
Today, we're going to extend that principle both to people whose plans have changed since the law took effect and to people who bought plans since the law took effect.
This comes after issues plagued the rollout of the Affordable Care Act. Glitches on healthcare.gov prevented less than half the estimated users from accessing the site. Critics of the rollout have also taken issue with what they call a number of broken promises from the administration.
If you like your healthcare plan, you can keep your healthcare plan.
Well, that turned out to be false for millions of Americans. Obama used that as a key talking point on Thursday's announcement. Critics also complained the president promised health insurance premiums would not go up, but for some, they did, and significantly.
I understand why folks are frustrated. I would be too. We fumbled the rollout on this healthcare law.
The new adjustment only applies to people who have already had their insurance policies canceled and will allow them to keep their policies through 2014. It also gives state insurance commissioners the option to follow through with the proposal or not. The canceled plans did not comply with Obamacare coverage requirements. But the announcement is definitely no surprise. On Thursday morning, House Minority Leader Nancy Pelosi suggested a change was in the works.
Stay tuned. And just see what it could be an administrative fix, it could be a legislative fix. I would rather it be done administratively because that can be done much more quickly without any accompanying agendas.
Obama's announcement and the fumbled launch has been a bit of an embarrassment for both the president and some Democrats alike.
Well, there's almost a rush to the exit doors, Michael, for some incumbent Democrats who are up for re-election next year. Officials seem to be reacting to those enrollment numbers by saying they don't have anywhere to go but up.
The government projected 500,000 people would be enrolled in Obamacare by now, but only 106,000 have actually signed up, most of them not going through healthcare.gov.
There's no doubt about it. This is red meat for President Obama's political opponents. The Republicans have vowed to fight this legislation tooth and nail every inch of the way.
And the so-called fumbles have only added leverage for Republicans. Before Obama even began his speech Thursday, House Speaker John Boehner made it clear he still wants the law thrown out.
When it comes to this health care law, the White House doesn't have much credibility. And let's be clear, the only way to fully protect the American people is to scrap this law once and for all. There is no way to fix this.
But what does this mean for insurers? Well, according to CNBC, they're not happy either.
The insurance industry is complaining bitterly about it. They're saying that basically this is blame shifting. It's not actually a fix because it doesn't compel anybody to do anything.
The House will vote Friday on a proposal to require Health and Human Services to allow anyone who wants to keep their old plans to do so, even if it falls short of Obamacare requirements. For Newsy, I'm Jasmine Bailey.